Hey everybody. We have had a few recent situations with fetal malpositioning in our practice. So today I want to talk to you all about how to support optimal fetal positioning for labor. So how do you work, or what can you do to help keep your baby in the best position possible to allow for an efficient vaginal birth? There are a variety of different things that we talk to people about throughout their care, but I'm going to talk about some of the physical things that you can do in the second half or third trimester of your pregnancy. So the first thing that's really easy to be mindful of is to avoid reclining positions. So we talk to everybody about being forward leaning, and to avoid, literally sitting in recliners or sitting far back in deeper couches. Instead, prop yourself up with pillows and try to be more forward sitting, or instead of sitting on a couch at all, use something like a birth ball. And this is important at the end of pregnancy because it encourages baby to be anterior, meaning they're back in the front of the pregnant person. When people are reclined often, it can sometimes encourage babies to swing their back to the back of the pregnant person, and that's a posterior position. And that is something that makes labor really, really challenging and sometimes inhibits somebody from being able to have a vaginal birth. Other things that are great for fetal positioning overall are to do body work. So we encourage people to get regular chiropractic care at the end of pregnancy. At the very least, we recommend people start at 36 weeks of pregnancy and get a chiropractic adjustment every week up until they have their baby. But what's even better than that is starting chiropractic care earlier in pregnancy to support the best pelvic alignment that you can to help baby be in the very best position within your pelvis. We also talk to people about getting acupuncture. Acupuncture is really supportive to the body and overall physical well-being, and it's just a nice complement to chiropractic care in terms of supporting optimal fetal positioning. Additionally, there are many different positions that somebody can get into, or different things someone can try in order to move a baby that is already in what's called a malposition or in a suboptimal fetal position. So we recommend the website Spinning Babies. It's spinningbabies.com. And they have so many different amazing techniques for turning babies who are breech, for moving a baby who is posterior, or for helping correct a baby that's in a transverse position. And all of these things are really important to supporting a vaginal birth. So if you are in your third trimester or near the end of your pregnancy, I recommend checking out Spinning Babies to get ideas of the best things that you can do really on a daily basis, just to encourage your baby to be head down and anterior up until you go into labor. The other thing we think is really important, and this is something that midwives do, is to have a provider that feels your belly. So, unfortunately, we hear from a number of people that they had a cesarean birth because their baby was breech, and it was something that their providers found out at the very end of their pregnancy, and that nobody was necessarily checking for or feeling for until somebody was 37, 38 weeks pregnant. And there is so much that you can do before a cesarean birth to try to move a baby that is malpositioned. So the best way to really prevent this type of scenario is to have a care provider that's hands-on, palpating your baby, feeling for the position of your baby, and feeling confident about the position of your baby throughout your entire third trimester. So those are our main recommendations for optimal fetal positioning at the end of pregnancy and to support a vaginal birth and the most efficient labor possible.